Okay, so just as a heads up, you are going to be tested on gout. It's guaranteed, at least during nursing school for sure, and possibly on the NCLEX as well. So let's talk about gout and the things that you absolutely need to know. So gout, basically what happens is it's urate crystals deposit in the joints and body tissues. And what happens here is these are, like it says here, these are little crystals. Okay, so these urate crystals deposit throughout the body, and this causes a tremendous amount of pain. The reason it happens is due to hyperuricemia, and this can be caused by either increased purine synthesis or dietary intake. It can also be caused by heredity or decreased renal excretion of uric acid or alcohol intake. The ones we're going to focus on here are going to be dietary intake, okay? That's what you're probably most likely going to be tested on, and we're going to talk about how to kind of identify that, okay? So, but the big thing here is what we're talking about purine or uric acid. Okay, so either increased purine synthesis or intake or decreased uric acid excretion, okay? Got it? So what happens is we have painful joint swelling and inflammation, okay? So if we kind of examine here this little joint here in the foot, you have this swelling within that joint, and the reason that it occurs is because you have all these uric acid crystals, okay? So those, you can imagine how painful that is, all those little crystals along that joint, and that causes that's where the gout is, okay? It's the deposit of all that uric acid. And these swellings here is what you see is this begins to outpouch and cause the swelling of the joint. That's known as tophi, okay? Tophis are the nodules that develop on the skin near those joints, okay? This can also cause pruritus, and it can also lead to renal calculi. So we have all these crystals, okay? So we have this increased amount of this uric acid, and that can actually lead to crystal development and formation within the kidneys themselves, okay? So the big thing I want you to keep on mind here are these tophi. So if you see a question about tophi, your mind is going to say, okay, that's gout, okay? Or the question might ask you, what are those called? And you need to just recognize that they're called tophi. So, and then it's going to be very, very painful to this patient due to all these crystals in there. You can just imagine how painful that would be. So what do we do for our patient? Well, first thing we need to do is, of course, avoid purines, right? Purines can be found in organ meat, wine, and aged cheese. Now, most of us probably aren't going to intake so much of this that it's going to lead to the problem, unless you had a really bad exam here and you decide to take a little bit too much wine or whatever. But what can happen is if you take too much organ meat, you take too much aged cheese or wine, these are actually foods that contain purines, and so that would lead to the increase in uric acid, okay? So this would be the foot of a patient who has gout. You can see the gouty joints, the pruritus, the tophi, and just how painful that must be to these patients, okay? So I want you to keep in mind organ meat, wine, aged cheese, okay? We want to have them take increased adequate fluid intake. That's going to help flush the kidneys, keep the kidneys healthy with all this extra buildup of these uric acid. Then you have bed rest during exacerbations, okay? They're going to go through these periods of exacerbations where it's going to be much more painful to them. And the thing they need to do is they need to really stay in bed and kind of rest. Some of the medications we can give to our patients, again, of course, are going to be anti-inflammatories. And then one medication you need to keep in mind specifically for gout is going to be this anti-hyperuricemic medication, allopurinol, also known as Xyloprim. Okay, this is the medication you're going to see given for gout. So if you have a patient in the hospital, they're getting allopurinol, also known as Xyloprim, you need to automatically say, well, this patient must have gout. Or if you hear that a patient has gout, one thing you could do to really impress your professors or preceptor or whatever would say, are we giving them allopurinol? Okay. So the things I want you to keep in mind with this are uric acid, purines, which are going to be like organ meat, wine, aged cheese. There's others, of course, too. I want you to keep in mind tophi, which are like these little nodules that develop. And then I want you to keep in mind allopurinol. Okay? And then when a patient has these exacerbations, you need to have them rest and relax and try to kind of make it through the exacerbation. Okay, those are the things I want you to keep in mind. If you have any questions, be sure to let us know.